cells, put them in a dish. There's a doctor at the VA, Dr. Alan Lichtenstein. He goes at the VA in West LA. That's kind of his thing he studies. Or I don't know if he's doing as much anymore. But if you take steroids and you put them in a dish, they will kill myeloma cells. If you put steroids and you put it in, somebody takes steroids in their body, it suppresses those hormones. IL-6, tumor necrosis factor, interleukin-1. So thalidomide kills the myeloma cells. It also suppresses those things. So the steroids, and people use steroids as a broad term.
Yeah.
These are not Barry Bonds or Alex Rodriguez steroids. These are corticosteroids, really, glucocorticoids. And we all make them in our body. And you're supposed to make them when you're under stress. And it actually can suppress, it's designed to suppress your immune system and kill some of the cells in your immune system. So myeloma cells are part of the immune system. So steroids, glucocorticoids, will kill myeloma cells. The problem is, just like any other drug, some people's myeloma cells are very sensitive to it and it just wipes them out. Other people, not so much. The side effects of the steroids obviously vary a lot in some people. So some people, I actually have a young lady who was on that oral Velcade-like drug and Revlimid and dexamethasone, and it worked great, put her in remission. But then her disease started to come back. It looks like it's the steroids. Of all those three drugs, that's the most important one for her. The problem is that's the only one that bothers her. The other one she could take like candy that had no side effects. So now we're stuck. It's like, well, you treat the myeloma, we're going to have to bump up the steroid intensity. 8 milligrams isn't enough.
Which means that your immune system will go down.
The steroids do suppress, because they kill some healthy cells, it does suppress the immune system. But myeloma that's out of control is even worse on the immune system than the steroids. But you're right, the steroids have as a side effect, they suppress your immune system, they give you cataracts, they make your skin thin, they can and bruise real easily, they make your muscles weak, they affect the mood, they make you hard to sleep. So all those things, it would be nice to have a different steroid, one that would work without those side effects, but it's not clear you could separate it. Like if it's going to work, it's going to cause those side effects, unfortunately. And steroids are cheap. The drug companies aren't so excited about making a new steroid and studying it, unfortunately.
Thank you.
Yeah, I think that was it.